Greetings all. I hope you're having a great evening. I'm Dr. Wilkinson and welcome to our Monday Night Wellness Watch. We welcome you to watch our past Monday Night Wellness Watches via our Facebook page at Wilkinson Wellness Lab or on our YouTube page. We also have a write-up on different health topics posted on our website, www.wilkinsonwellnesslab.com. So check it out and feel free to explore. Tonight, we are discussing another very important topic impacting the nation's health and also greatly impacting our community. Did you know 9 out of 10 adults in the United States struggle to understand and to use personal and public health information because it's filled with unfamiliar terms, very complex terms. In that vein, improving health literacy, if we can improve health literacy as a country, it could prevent nearly 1 million hospital visits within the United States each year and save us over $25 billion annually. So as public health, community health, health and human services, organizations and entities, we got to do our part. We can improve the health literacy if we practice clear communication strategies and techniques. And that's in partnership with our education system. And to that end, I'm excited about tonight's topic. I'm going to introduce our panelists tonight, but we're going to be led by our host for the evening, Miss Jacqueline Nicholas. And I'm going to let her introduce herself and come in her own way. We also have Dr. Charlene Newman, who you'll hear a little bit more from the University of Alabama. We have Angela Orr, Miss Angela Orr, also joining us this evening. And she's going to come in her own way and talk about the efforts that she has through her organization, Advancing Health Literacy. And as always, we are joined by our community partner, who is all things in the community, Miss Dorothy McAdory as well. So pleased to have them. My interns are also with us. They're just not on camera tonight, but they're engaging on Facebook and are being a channel of your voice to join us in this chat tonight. So as you have questions, please post them on Facebook. My interns will bring them to us through the chat and we'll address them as we go. So thanks again for joining us as you do many nights on many Monday nights. We appreciate your support and your engagement. And at this time, it's my pleasure to turn it over to Jacqueline Nicholas, Miss Jacqueline Nicholas, who will host our discussion tonight on health literacy. Jacqueline?
Thank you, Dr. Wilkinson. I do appreciate this opportunity. Good evening, everyone. My name is Jacqueline Clark Nicholas. I am employed by Birmingham City Schools in the Educational Technology Department, where we are building leaders and impacting the world. We manage the learning management system for Birmingham City Schools, the entire district, and I have a pleasure doing so. I am also a graduate student in the doctoral program at the University of Birmingham at Alabama, pursuing a PhD in educational studies of diverse populations. I am of the mindset that you are either part of the problem or part of the solution, because I endeavor to be part of the solution in the health area. I am an advocate for health literacy because I'm concerned about minority populations being disproportionately represented among the United States adults who have limited personal health literacy. So when I positively impact that demographic, I'm also addressing racial and ethnic disparities. It is my pleasure to be with you all this evening. At this time, I would like to ask our guests to introduce themselves, your organization, and its mission to address health literacy. Dr. Newman.
Hello, my name is Charlene Newman. I'm a professor and the executive director of the Alabama Life Research Institute at the University of Alabama. The Life Research Institute has as one of its goals to improve the lives of people in the state of Alabama using the research of our faculty. One of our research themes is rural health and health disparities, which brings me here today. And we've been working in our communities. One of those communities is Mrs. Orr's community, to try to improve health literacy, but also just to learn more about the needs of these communities so that we can bring together teams of faculty to address some of the issues that they experience.
Thank you, Dr. Newman, for your time, your attendance here today, and your advocacy for health literacy. At this time, Mrs. Orr, would you please tell us a little bit about yourself, your mission and your organization, and how you address health literacy?
Yes, ma'am. My name is Angela Orr, and I am the health navigator for the Advancing Health Literacy in the Alabama Black Belt for the town of Hobson City. I am the health navigator for the town of Hobson City. And my position in the Advancing Health Literacy in our community is to expose the youth, is to expose our elders and the median of the community to programs, to healthcare, health systems that they may be unaware of, something that requires exposure, you know, in underserved areas. So that is my objective, is to have our community exposed to what they need to know. And in that part, training them on how to be advocates for themselves in the medical area pertaining to their lives and their family lives.
Thank you, Mrs. Orr, for your time and attention, and also for your advocacy for the underserved. Thank you. At this time, would you please introduce yourself to everyone online tonight? Ms. Wilkins, I'm sorry. Mrs. Orr, you introduced yourself. Mrs. McAdory?
Thank you. I'm Dorothy McAdory. I am a community activist. I am with Congregations for Public Health. And what we do is, it's a mission that started early 2000s. And what we do is we try to bridge together congregations to teach them about health disparities and educate our communities on health issues that affect the lives of everybody in that community. So we have classes at the Birmingham Union Baptist Bible College, where Dr. Wilson Fallon Jr. is our president there, and what we partner with the Center for the Study of Community Health. And with that, we have interns come in from the School of Education, Dr. Wilkinson, and they come in and they will do research on certain health topics to inform our community and make them aware of some things, life-changing situations. We teach a lifestyle change as well, but lifestyle in their community is important to them and to us, that they understand and that they're educated about life, health disparities, and how it affects our communities.
Okay, thank you so much. I can't tell you enough, Ms. McAdory. You are well known for your community activism, and I can't thank you enough for what you and your congregation does and you do in the community. Thank you so much. Greatly appreciate it. And thank you for your time here tonight. At this time, you all, I'm going to start presenting you all with questions pertaining to health literacy. And please be honest as you possibly can in your answers, because what we learned here tonight could affect so many people positively. So once again, thank you for your time and attention. I would like to begin with the question, what is personal health literacy to you, Mrs. McAdory? What does it mean to you?
Personal health literacy to me is the lifeblood of me and the community. That means whatever affects me, if I'm not careful to take care of it, it's going to affect everybody around me. So I want to not ignore the issue, but face the issue and address it, and then help those around me to understand what we're doing to make it better for everyone. That's
thank you very much. Yes, thank you. Dr. Newman, what is personal health literacy?
So I think one of the easiest ways to think about health literacy is to think about literacy maybe more generally, right? So literacy is more than just your ability to read, to call words, right? Literacy is your ability to understand, to comprehend what you've read. And health literacy is similar. It's your ability to find and to understand and use health information, right? So it's your ability to go on the internet and sort of look for information and know what information is reliable information, right? So you said to be personal. And so my daughter is a hypochondriac. And so when she was younger, she'd read something and she was dying every other day because she read something on the internet. And so she's like, I have that. And I'm like, no. And so it's really your ability to find reliable information, understand that information, and use that information to improve your health.
Thank you for your transparency and being honest. Thank you for sharing that personal story.
We have lots of people who they read something on WebMD and they have it, right?
Yes, yes. Thank you for sharing. Thank you. Mrs. Orr, what is personal health literacy to you? How would you define it?
Well, I define it as personal health literacy as, as Dr. Newman and Mrs. McAdory said, the ability of an individual to find the information that they need for themselves or someone else to understand the information, let's say from your physician, to understand what they're actually telling you, to comprehend it, and to be able to use the information to benefit you. So that's how I define the personal health literacy.
Very good, thank you. Could you address how COVID-19 helped pull back or brought to the forefront the health disparities within the minority communities? Could you please address that from us, Dr. Newman?
I think it didn't really define the health disparities. What it did was it revealed the health disparities to the world. So we always knew, researchers anyway, and physicians always knew, and the community knew that they had poorer health than the average American, say. But what COVID did was brought that information to the fore. Seeing people dying at disproportionate rates is what got a lot of people's attention.
Right. Oh, yes. Yes. Could you please tell us, Mrs. McAdory, what you think about COVID-19 and its impact upon unveiling or revealing or bringing to the forefront the disparities in health equity for our minority communities?
What I think about that is that it was like a picture, and it caused everything to stop. People were dying. And let me tell you about disparities. Whatever the issue is, if somebody else has it, African American has it worse, and they die from it. Right. And that's a part of where our trust is we look at the doctors and they don't hear us, and we're going to die anyway. And that's a bad way to think and be. But I'm going to tell you that when COVID-19 came, it affected everybody.
Right.
And but more than anything else, it unveiled the African American and their struggles within about what was going on with them. They had to explain it, display it, and see it. And let me tell you, if we had what we could not explain to the doctors before, if our immune system was not up to par, and we contacted COVID, who was the first to die? The African Americans were, because the things that we had struggled with on the inside of explaining and having whatever our diagnosis was explained to us, and then we were treated accordingly, did not happen. But with COVID, that was an unveiling.
Thank you so much. Mrs. Orr, what are your views on COVID-19 and how it brought to the forefront disparities in health equity?
My view on COVID-19 and the exposure, I would call it an exposure that was, you know how the term is being used, veil, how you peek behind a veil, but this time the curtain was drawn. You know, we were fully aware of the disparities. You know, it seemed as though if if there was something going on with the body, African Americans most likely suffered from it. And at the same time, being it may have been economic status or educational status to where we felt as though we just could not get the proper medication or the top-notch physicians to actually care. But what we found is that actually it does not matter the economic status or the educational status when it comes to the disparities. And COVID-19, it just exposed some things. You know, COVID came out in 2020, they said actually 2019, but you know, in the world of religion, you know, we were saying 2020 is for vision, but 2020 came out to be complete exposure to how African Americans suffer within the United States. You know, how where it originated, they said that it originated in China, and how, you know, but at the same time, we just seem to get the brunt end of the COVID-19, and it just it wreaks havoc within our community. And I just truly believe that it was it just let the world know that these people, African Americans, are not simply complaining. We have a legitimate complaint that we are not receiving equal medical care.
Thank you so much. At this time, Dr. Wilkinson, would you please add something, your viewpoint on the COVID-19 pandemic and its effect upon minority and disproportionately affected African-American communities?
Yeah, I think that these are very strong points. I think that, you know, one of the things that we have seen among the African-American community are inequitable opportunities to access care. We see that, you know, folks who are poor and underserved may have less access to healthy fruits, vegetables that are providing the vitamins and minerals that are needed for their bodies. I think that we can talk about educational access and quality as well. Really what we're talking about here are the social determinants of health. And if you have individuals who have less access to quality care, are living in neighborhoods that are challenged, the built environment is challenged. If you're talking about a social and community context that is struggling, and we can talk about access to foods, we can talk about access to safe places to work, to play, to practice their faith. When we talk about our educational quality and the challenges with that, we're really talking about the social determinants of health. And what we're saying here is that these social determinants or these social environments have an influence on our overall health and well-being. And so we have to work to address these systemic issues while also working on ourselves. To improve our own literacy, to improve our own behaviors, to improve the way that we operate, as well as the context that we find ourselves in. So even going back to the topic of health literacy, if we're talking about health literacy, yes, it's the way that I take in information. It's the way that I seek information, but it's also the way that I relay information to others. And so I don't want to tell Dr. Newman wrong information, or Mrs. Nicholas wrong information, or Mrs. Orr wrong information, or Mrs. McAdory wrong information. But if I am spreading information that's untrue, or that's something that I just heard, then I'm also spreading the myths, spreading the rumors, or spreading the untruths that are going to relay out into the community. So it's so important that we see our responsibility to advocate, as Ms. McAdory stated earlier, to advocate for, you know, better access to care, better access to education, a better social environment for us to to operate in, but also to do the work ourselves to make sure that we're taking in good information and relaying out good information as well.
Thank you. That was
I
an
want to add
Mhm.
something else to that. So one of the things that we've been thinking a lot about within the Life Research Institute is this relationship, because there's a lot of talk at the National Institutes of Health about structural racism and the impact of structural racism, right? So, but there are also some issues around our communities. Like part of the reason why our health is so bad, yes, there's the structural issues around access to care, but there's also the chronic stress that we experience as a function of racism, right? So it's not that we're experiencing stress out of nowhere, right? It's a function of racism, and it's also a function of our of how we manage that stress or don't manage that stress, right? So you're experiencing financial stress, you're experiencing, racism on the job, you're experiencing, your child isn't getting great education, you're stuck in places, right? So what some of us do, we eat. Some of us drink, some of us smoke, some of us do drugs, some of us do all kinds of things to manage that stress in unhealthy ways, right? But on top of that, the stress itself is destroying our bodies. Right. So our bodies are weak because of the stress. And now you have COVID-19 that comes in and it sort of completely causes all these other problems and causes these deaths, right? So it's a combination. It's always a combination of, right. And I don't want to put it on personal responsibility because there's structural things in place that sort of set the stage. Okay. But we do have to learn how to manage stress better. Okay. We have to find other ways to manage stress besides eating or drinking or whatever our sort of way is. And I'm guilty because I eat Cheetos whenever it gets stressed. I go straight to Cheetos. That's my drug of choice, right? Everyone does something.
You're right.
It's a very good point. We have in a lot of ways because of the economic instability or the social community context that we find ourselves in, we have a sharper hill to climb. Yeah. And so personal responsibility is important, but there's a greater strain that we have to overcome because of the additional stressors. I can't remove this. I don't want to, but I can't remove this. Right. So the way that I may be perceived may cause others who may be in different positions to look at me a certain way, or to deny me an opportunity, or to deny.
And that doesn't go away because you're successful.
No.
In some ways, it gets worse. We just saw Judge Jackson get sort of hammered, right? She's at the top of her game.
Right.
But it doesn't go, in some ways it gets worse. The higher you climb, the worse it gets. It's some
I agree, it gets worse.
No one prepares you for it.
And we've seen studies of that as well, with greater amounts of stress among individuals who are kind of what some people would say more upwardly mobile, but they have greater amounts of stress because that's associated with perceived discrimination than folks who may have not been so upwardly mobile. And so we have to deal with that, as Dr. Newman said as well. So there are a multitude of issues and challenges that we can discuss, but I think that one of the things, Dr. Newman, that you brought to light that I think is Mrs. McAdory, that you also shared, was how this stress degrades our body and our immune system. And so we become more vulnerable to diseases and infections because of the way that the stress works against our body. And so for all of you who are watching tonight who may share similar features as we who are on this panel tonight, you know, it is something that we have to consider. Now, that's not to say that everybody has the same experience, and that's not to say that all people of color experience racism or experience discrimination on a daily or very consistent basis, but some do. And I think it's fair to say that it should be considered as we're talking about the different stressors that we encounter and the different ways that we have to navigate our health and our well-being.
That's so true. So
And to bring that back to health literacy, I think it's important for us to know, right, and understand how stress is interacting with our health, right? And so
And
that's
may I say with,
Mhm.
sorry, excuse me. With that, with the advanced health literacy grant, with that, that's why it was initially for COVID-19, but we address every aspect of life. We address this month, and it will be for autism and alcoholism. So there are many facets. We don't focus only on COVID-19. We have a wide range to what we want to educate the community on. And, you know, we offer so many opportunities for them to come and receive literature, for them to be, we have great speakers. Dr. Newman have been one of the great speakers. And we have physicians, our physicians that look like us, to come in and to give their education, educate our community about their bodies, about the stress, as Dr. Newman talked about. So we don't just focus on COVID-19, pretty much every aspect that you could think of. And we asked our community, what do you need? What do you want to hear about? What do you need us to talk to you about? And we go from there.
Okay, thank you all so much for what you do for health literacy. I do appreciate everything that you all are doing to bring about health literacy and your impact upon our community. So thank you. I could not be an employee of Birmingham City Schools and not ask you all this question. Could you please expound upon the impact education has upon health literacy and health disparities? Dr. Newman, would you be kind enough to answer that question for us?
Well, sure. So again, at the core of health literacy is literacy, right? So it is important for us to get a really strong, sort of solid education, so that we're taught how to think and how to think critically, right? Because again, it's hard to understand or to determine what information that you're coming to that's reliable. Right. We see that now all across the place. Like we're bombarded with like fake news and fake social media posts.
Yes.
So how do you sort of look at that and know, okay, that's real, I can believe that. Oh, that's trash, I can't believe that. How do you, but that's all a part of the education teaching. We should be teaching our kids to think critically so that they don't take something in and just believe it because they saw it online.
Right.
They do some research to verify it. Right. So that's a part of it. But I mean, the reading comprehension part, of course, is also critically important. But sometimes you don't necessarily have to be a great sort of like, because people have other things like dyslexia that may make it difficult to read. But if you can think critically, if you question,
yes,
if you search for additional information, those are things that our education system should be teaching our kids how to think for themselves. And that's one of the things I push at the college level. Is like, it's not about me sort of feeding you a bunch of facts.
right.
I need you to be able to problem solve and figure things out and go search and find information, because facts change. My classic example is like Pluto was a planet when I was a kid. Then it wasn't a planet. Now it may be a planet again, but a minor planet.
Right.
So, facts change, but you have to be able to think. So that's the important thing. And that's what I think our education system should be there for.
And
Dr.
some
Wilkinson?
television app, a live stream app, Pluto is.
Thank you, Ms. McAdoo. Dr. Wilkinson, would you please tell us what you think about the impact education has upon health literacy?
Yeah, so, I go back to my days in undergrad at Tennessee State University, and the motto of my university is think, work, serve. And that first word, think, is so important. And so, I challenge my students similarly. I tell my kids this almost every day, or they'll tell you it seems like it's every day. America, the world needs problem solvers.
Right.
The world needs problem solvers. They don't need right, or what we think is the right answer, copy and pasters.
That's true.
Right. And so when you're in school, you just want to get the right answer, and you just want to copy it, paste it, and put it into, the document, or answer it in that way. And you just really care about getting the correct score. But really, I challenge all the K through 12 or the college students who are listening tonight, or young adults, period, to really work to be problem solvers, to work a process to really figure out what the problems. A lot of us wouldn't want to take our car to the mechanic, and the mechanic takes a look at it and says, oh, I see this problem right here online. I'm just gonna do what it says do, and not even think about what the problem would really be. Right. Because they could have just went to the wrong source, got the wrong, what we would call right answer, do it, and then charge us for it, and then the car still doesn't work. And similarly, we want to think about what the problems really are, think about what the probable solutions are, work a process to narrow down what those solutions, what we hope will be the best solution, and then enact that solution. And then guess what? If that's not the right solution, let's go through a process of refining our actions until we find the right solution for the problem. And that takes thinking. And I think sometimes a lot of us don't really want to spend that time and energy. But that's what education really truly is all about. And I was telling a student just the other day that I'm not teaching second graders algebra, that there's steps from grades, kindergarten on up to 6th and 7th grade before you really get to algebra. Why? Because it's a process that builds on one another. And so, can you imagine teaching algebra to second graders and first graders who just really finished their ABCs and 1, 2, 3s? It takes time to learn. It takes time to educate. And so as we do so, and as we learn more, as we grow more, as we develop more, then we're able to understand more complex circumstances and situations and problems and challenges. And that's why education is so important, because even I don't understand all, and I say even I as I'm somebody, I'm not, y'all, but what I'm saying is I deal with public health and medical terminology each and every day. And I'm learning each and every day, just like the rest of us, about COVID. No one knew what COVID was. COVID kind of came out of nowhere. We started to learn, and sometimes we got some things wrong. Many times we got some things right, but as we understood more, we understood what to do and what not to do.
That's true.
And it takes a scientific process of problem solving in order to find the right solutions that can, in this case, save millions and millions of people. And that's what happened as we work to address the problem of COVID. Similarly, we need problem solvers, thinkers, who can think our way through tackling the problems of today and tomorrow. And so we're training those, Jacqueline, you're training those problem solvers of the future right now through education. And that's why education is so important as it relates to COVID-19 or any other challenge that we got to address in the future.
Okay, thank you so much for that wonderful answer. You all, and you know this, Ms. McAdora, you've heard this before. It is so much better to be asked up than asked down. So because Dr. Wilkinson asked me to facilitate this tonight, I'm going to be considerate of you all's time. I'm going to go ahead and move it along because you all believe the time is running out and you all have been given such wonderful answers. I want to ask you, Ms. McAdora, what is health literacy's impact on the quality of life for demographics prone to chronic conditions, such as diabetes, hypertension, being overweight, and having cardiovascular disease? How would health literacy impact these communities?
Health literacy understanding, and I say this all the time, stop killing our babies. We stuff French fries in their mouths. What about a strawberry?
Mm.
Let's change. And even if we are in an area that is underserved demographically, let's look around us and see what we can do to make a change. Allow our children to taste something different. They may not like it at first, but continue to try, okay? Give them something healthy that it can change their thinking. And the other thing is this, if we provide healthy, and I understand underserved, the demographic, we may not be able to get everything we want, but we can get some things and do it well. When we get the collard greens, let's not overcook them. Let's feed them well to our babies, okay? And if we look seriously at the stressors that we were talking about earlier, personal accountability is important. Personal accountability, because precepts and examples still work. People are watching you and what you do. And if you do it and you don't get it right, so this is why communication, where we're going, Dr. Newman, is so important to our people. We must communicate so they can learn to follow a trail of communications. Take it back, bring it forward. Eat it, chew it, regurgitate it, whatever you have to do, but get it down so that you get it within you. And let's change the way things are. We can do it one at a time. We can't eat the whole elephant, but just a bite at the time. And in educating our people in understanding. And somebody has to make the sacrifice. That's why community is so important, to take the time and stop long enough to listen and try and help those that may not understand to understand.
That's true.
The impact of literacy and health literacy is our life. Our health is our life. Our health is our wealth. We're talking about the quality of how you're going to live and your children are going to live, the generations after you, but you have to stop and teach it as you go.
Okay, thank you.
Thank you so much.
No, thank you. Mrs. Orr, could you please tell us how you reach and address communities with limited experience speaking English? When you have English language learners, how do you reach them in the area of health literacy?
Well, we have not actually come across that in our community because in the town of Hobson City, 98% are African American. There's less than 1% of Hispanic or any other. The other percentage is actually Caucasian. So within our area, we have not had to deal with that, but I am sure that is something that we will, actually, that is something I will pose to the grant officers, you know, that there's a possibility that we may run into a community of Hispanics or another origin. And we need to be able to address and talk with them and give them the same benefit because they are of color as well.
Yes.
So as of now, we have not had that situation.
Okay. Dr. Newman, have you had an impact? What is your impact on the English language learners or students or people that are Hispanic and their health literacy? How do you impact them?
Yeah, so in the program that Mrs. Orr is involved in, we do have a Spanish speaker, a native Spanish speaker who acts as a translator.
Yes.
And so because some of the communities do have larger Hispanic populations, right? And so it can become sometimes tricky because you just need to go and talk to them in Spanish, or help them fill out forms in Spanish. And so
Yes.
we just need to have someone who can be there to do that translation. It's just important to do, and depending on where you are in the state, you just have to have a translator. So we do have a translator. And we also try to work with some of the students, the high school students who are learning Spanish and may have more sort of Spanish background, to give them that opportunity to act as a translator as well, right? And so there's some students who could also help out sometimes, and we do that. We've also talked about, because a lot of times the Spanish speakers have children who are bilingual, who are like
Yes.
heritage speakers, and so working with their children as their translator is something else that we try to do. But so far, I think we haven't translated any of the material in Spanish, but it hasn't been asked for. But if it's ever needed, then because we have a translator, we can do that.
Okay, I
Right.
asked that question because we had such a growing demographic. I was just wondering how you all addressed it. But thank you all for your wonderful answers. What strategies can individuals, communities, and organizations utilize to improve health literacy? Mrs. Orr?
Well, some of the strategies that we use concerning the grant, we have some great surveys that we go out and we go into the community. And actually what we have done within the town of Hobson City, when we have events, we have offered incentives that you come and let us and complete these surveys so that we can better serve you. So we have surveys, we have health fairs, we have community engagements. We also have what I would consider forums. And generally we have them with the elderly, but there's a diverse in the age groups to where we're actually able to communicate with them, and that is the way. Lately, I have been, due to COVID, have been speaking with persons over the phone because people are not necessarily welcoming everyone into their homes because they don't know if you have COVID. You're unaware if they have COVID, even though we wear the mask. We promote masks and the mask wearing, but at the same time, so I have found it quite serving to call them. Actually, I have a telephone book. Some people that's online probably don't know what a telephone book is, but I actually have a telephone book in which I just randomly pick select numbers and call and talk with the people and ask them if they would like to complete a survey. Of course, I let them know Health and Human Services, advise them of who I'm with and the purpose. And some are polite and actually will go answer the questions for me, and I complete the surveys and send them forward.
Okay, very good. Dr. Newman, what strategies can individuals, communities, and organizations utilize to improve health literacy?
Honestly, there's no easy way. There are no shortcuts. I mean, it's really about getting into the communities and talking with community members. I think that's really the only way to do that. And I'm sometimes a little Pollyannish when it comes to to this kind of thing, because I'm like Ms. McAdory sort of said, we need to teach. And I think if people understand diabetes and how diabetes works and what they need to do, then they'll do better, right? If they learn, if they're taught or told like how to cook collards in a healthy way, they will try it, right? If we just provide the information in a way that they understand it, then people are everybody wants to be healthy. I don't think anybody out there wants to be sick, right? And so there's no easy way to do it. You just really have to get out and meet people where they are. And sometimes it's hard to get people to stop using, pork in their greens, but you can maybe slowly kind of like, okay, come and do a cooking class and say, taste this, and then you can change people's minds, right? So it's really just about getting out and educating and not talking down to people.
That's true.
Or having conversations with people is the only way to change that. The other thing I think is to use the youth, and one of the things that we've been doing is really having conversations with young people, right? Because they're the future of those communities, and if you can teach them and get them to change some things, then you have a sort of a hope of that community being healthier later, right? And educate them. And just like the old sort of stop smoking campaigns when we were young, they focused on kids and kids nagged their parents to stop smoking. Using the same kind of thing where you sort of teach kids and then they nag their parents like, no, let's not have that. Let's do this, or let's go for a walk, or
Yes.
I think it's also about using like everybody in the community. I mean, and kids can actually, they have more power than I think they realize they have, and tapping into the power of the youth, I think, is also important.
Thank you for that wonderful answer. I could not ask a question about community without asking you, Ms. McAdory, what do you think about how to reach and address communities with limited experience speaking English? Facilitating help in the community?
Well, one of the things that I found out when I was taking some training with Connection Health at UAB, and we all are alike in some kind of way. And so what we have to do is we have to find a way to communicate, speak, show, as like show and tell action, and try and reach those people that are different from you, that they still understand what you're talking about, that they might be able to make those changes. Because like I said, we all have just about the same thing, okay? Especially, if you're if you are, say, Hispanic, they are so much, because if they eat the same kinds of foods almost, so it's just changing the mindset and the thought of how we're doing what we're doing that will make a lot of difference. But we got to never fail to look for opportunities to make a difference.
Right. Maya Angelou said, when they know better, they do better.
Yes.
So we're going to, yes, Dr. Wilkinson, because I know I've taken your class. I know how much you're involved in the community and your belief in helping and reaching out. Could you please expound upon some of the strategies you utilize when working in the community?
Yeah, sure. I start off by working with great people. I'm thankful for everybody's here. This is working in the community right now. Right now, it's 8:19. Y'all are missing dinner right now, or maybe you already ate dinner. Hopefully you already ate dinner, but we're here to address a problem. So first partnering with great people. And sometimes it hits naturally. Sometimes it's building trust and relationship. It's rolling up our sleeves and getting dirty and doing some good work together.
Yeah.
People don't care how much you know until they know how much you care. And I'm just a big believer in that. So working in whatever capacity through UAB that I can be of aid to our community, that's what I try to do, whether it's me alone or with my students. And I think that's another component of it is developing folks, in this case, young people who are doing the same thing, who have a heart and a mindset to do this good work. And so I'm thankful for my interns that I have as well. And so as a team, we go out there and and we try to win some. We try to tackle some problems. We try to motivate and encourage and inspire other folks to like you said, Jacqueline, act in our own best interest. There's not, most people want to live healthy.
Yes.
Most people want a better quality of life. Doesn't matter what station we're in, if someone offered, a hardworking individual a great opportunity to make more money on their current job or on another job, most people will take it. And it's the same thing with what we're offering tonight. We're offering an opportunity to address something in our lives that 9 out of 10 Americans have a challenge with, understanding complex medical information. So what we're suggesting in some of these strategies tonight, like bringing loved ones to the doctor with you, or if we're talking about bringing a child who can translate between English or Asian, Mandarin or Spanish and be a bridge to the doctor, we're talking about opportunities, very simple activities that we can all take in order to support one another and support our health. And so, that's what we're talking about tonight. So, Jacqueline, just going back to what you said, it's about building trust. It's about partnering with good people. If you have a like interest and you want to work, I want to work with you. And if we can bring more people, then overall we'll bring more and more and more and build this greater capacity that's going to overall change ourselves individually, but also be a strong impact in the community. And that's what we're seeing. That's what we're seeing happen. Someone mentioned on Facebook, I just want to address this before we go. Somebody mentioned on Facebook about having trust in our organizations like the CDC or NIH and look, as me and Ms. McAdory have had several conversations, trust within our own community. And what I want to encourage us to all understand is, it's okay to challenge the CDC. It's okay to challenge NIH. Look, it used to be we thought the world was flat. If someone hadn't challenged it, we'd all not take, flying or go on cruises or drive and get in the ocean because we'd be a little afraid that the world was flat and we were going to fall off. But some wise people, I encourage everybody to take a look at who proved these things, by the way. We'll get into that on another time. Has a little bit to do with Dr. Newman's background in engineering and how science really operates and who started creating that science. I'm gonna leave it right there. I want you to investigate on Google. Now that I've said that, because we challenged current standard procedure thinking, we developed an understanding that the world wasn't flat. Because we challenged certain standard thinking, we discovered gravity. We discovered how to make things, how to make fire, how to just do things differently. And so it's okay to challenge the CDC. It's okay to challenge NIH. I would even add that if you challenge them so much, let's try to get employed so that they can adopt some of your way of thinking into their system, because it's by challenge that we gain sharper, that we grow sharper, that we gain greater understanding. And so challenge is good, but when you come to an overwhelming preponderance of science that says that mask wearing is good, that vaccines can be safe, that we got to keep a cautious eye, but that adopting these things can help more so at a greater level than they hurt, well, then I think using our education, using our knowledge, and using wisdom, I think that we should adopt those things. And that's all we're saying when we're out there in the community and or when we're using social media and others to spread a message. And I understand that other people are doing the same. And look, so if you want to challenge something, also, if you're going to challenge good information, also keep a discerning eye to the information that you might just be so quick to adopt. And at least consider all the things before you make your final decision, and try not to be closed-minded. And I'm speaking really to everybody about those. I don't tell people, I'm not trying to get people to sacrifice their values. Dr. Newman, I'm sure you would agree, right? It's not challenging. It's not, or maybe it is challenging your values, but what I'm saying is at least consider before you dismiss. At least consider before you dismiss, and keep in mind who's saying what and how they're saying it. Because if I come to you in love, you know, then at least consider what I have to say and what other experts have to say, especially if what they're saying is considered beneficial to your life and your health. So I don't know if I said that all right, but I'm going to end right there.
Yeah. And just to add, I mean, it really goes back to using those critical thinking skills, right? That we talked about before, and being able to think through what information is coming from a reliable source, and whether the source is reliable, whether the information is reliable. But honestly, a lot of what I saw made me sort of question how well the education system did in educating people about how science works. Right? Science, I mean, what the recommendation was changed with incoming information, which is how science works. And so I think a lot of people just don't like that. They want it like it's the whole thing. They want one answer, and for that to remain the answer, but that's not how science works. I mean,
I think that's such a great point. And I don't necessarily want to build on it. I just want to reaffirm it. This is how science works, y'all. I mean, and let me just use this anecdote right quick. Do y'all remember the first iPhone? Do you remember your first smartphone?
Yes, of course.
How much would you want to use that same smartphone right now to be your phone each and every day? The smartphone that started in 2007, 2008. How many of you out there right now would still use that same smartphone on 3G, by the way? Maybe, I don't even know if 4G even existed. So 3G, 4G, how many of you would use that same smartphone? Or how many of you would rather use a newer smartphone that was made better because of advancing science? I would, being that my current smartphone is more capable than the computer that used to weigh 20 pounds that I used to have in my house back in the 1990s, I take my smartphone because science has made it better. Science has taken new information and made it better. Now, maybe it takes it too fast because I just bought my phone and now it's already obsolete. But my point is, I take science. And so we need more people to be problem solvers so we can advance the science. And who knows, in the future, you know, maybe this pen that I'm wearing will be the new smartphone. I can just push it and we'll be like in the days of Star Trek. Who knows? But this has been great. This has been awesome.
Yes.
Awesome.
You all this has been a powerful panel. You all have been wonderful. I know you all had allotted 1 hour of time. So thank you for taking the time, and you all were wonderful. You were honest, you were transparent. Your answers were just authentic. And I really appreciate you taking the time to speak with us tonight. And I know for a fact you all have affected the lives of so many, not just the ones that were watching tonight, but the ones that this will be relayed to after we get off. So thank you. And I appreciate everything you've done, and may God continue to bless everything that you do for health literacy. Thank you.
And thank you, Jacqueline, for so much for leading tonight's discussion. And thank you to Dr. Charlene Newman from the University of Alabama, and Miss Angela Orr from Advancing Health Literacy for joining tonight and spending your time, your evening with us. We don't take it for granted, and we so appreciate you taking this time. And Mrs. McAdory, as always, You're with us every Monday night, and we so appreciate the work that you're doing in the community, and we appreciate your wisdom that you're sharing, not just on here, but you're engaging with my interns on a regular basis, and I appreciate you. And speaking of my interns, thank you for the research that you did tonight to help bring tonight's discussion together, and for the work that you've been doing on Facebook. I've seen some of the postings this evening. I've got my eye on y'all out there too. So thank you for engaging. A big thanks to you for who have been on Facebook with us tonight. And for those who are going to be on in the future watching this recording, a big thank you to you as well, because not only do you watch the recordings, but many of y'all are sharing, you're liking the links, and you're sharing, and you're putting this out there in your groups and when you're with your families so that they can get this help information too. That's how we overcome the challenges of today and tomorrow as it relates to our overall health and well-being. As always, a recording on this talk will be on our Facebook page at Wilkinson Wellness Lab. I invite you to continue engaging with your comments and sharing your pertinent information. And you can always hit us up at our Gmail account, Wilkinson Wellness Lab at Gmail, if you would like to offer any suggestions, comments, recommendations for us to talk and discuss in the future. And as always, thank you all for your engagement tonight. Have a wonderful rest of your evening. And as always, let's live well and be well. Have a good night, everybody.